Well, good morning. I'm Patrick Erickson with the Inland COVID Response Joint Information Center. We appreciate you. Thank you very much for joining us this morning. Now, in a short amount of time, we'll have an update from Spokane County Health Officer Dr. Bob Lutz. But this morning, we'll also be hearing from the Inland COVID Response Food Continuity Task Force, including members State Representative Marcus Forcelli and Carly Courtwright, who's the co-chair of the task force. We'll also hear from Drew Moyer, who's the Senior Vice President of Philanthropy with Second Harvest. And of course, if you have any questions on any topic for any of our speakers this morning, make sure you share them right here on our Facebook page. We'll try to get to as many as possible. But first, we'll start with Dr. Lutz.
Well, good morning. I'm actually going to read from a script today, just so I can capture all the information here for you. Yesterday, as you know, Governor Inslee addressed milestones for our state that need to be met before we can transition to the next stage of combating COVID-19 after May 4th. I am also asked often what I need to see before I can start and we can start transitioning to a more state of normal here locally. Before we can begin loosening up on physical distancing, we need to be confident that the curve of COVID-19 cases is not at risk of rebounding. We're not there yet. We're cautiously optimistic, and we are seeing our hospitalizations and transmission rates decrease. In order to continue to see these positive results, however, we have to stay on course and continue the measures set forth by the Stay Home, Stay Healthy order. Yesterday, the governor also touched on another key milestone our community needs to meet before we can loosen up on our physical distancing measures. We continue on the work needed for testing capacity so that we can quickly isolate and treat people. Over the next few weeks, we will be working with our community partners to determine a plan to slowly ease off physical distancing that will allow our community to open safely and keep our friends, family, and neighbors safe and healthy. I want to refer to the graphs just to give you a sense of where we are. And these are tentative numbers, but as of today, we're up to 294 cases. Yesterday morning, we spoke about having 286 cases. So again, it's an increase of 8. No new deaths, thankfully. This again shows you that graph of new cases. And then to date, we've had 55 hospitalizations. And at this time, we still have 16 individuals currently hospitalized. So those are the numbers for today. And I'm going to ask members representing Second Harvest and Representative Forcelli to come up and talk. Thank you.
Thank you, Dr. Lutz. Hello, I'm State Representative Marcus Forcelli, and I'm going to be joined today by Drew Moyer from Second Harvest and Carly Courtwright, the co-chair of the region's Food Continuity Task Force. Drew will speak shortly, and Carly's here to help assist us in answering some questions that might come over the live stream. In this time of public health crisis, it's clear that food continuity for struggling families is a top public health issue in our region. It's critical that we understand the individual and collective food needs in our community and connect people to the vital resources so they can get by in this unprecedented time. We're in the midst of a public health crisis, and it's important to remember that food continuity is a public health issue. Food is health. The Regional Food Continuity Task Force is aware of increased demand on our food bank system due to increased unemployment. While there are many resources available for assistance, we want to connect to those that may be falling through the cracks. We created a forum to not only measure the need in the community, but to connect people, particularly those that are homebound, to food. This is a regional effort partnering with the City of Spokane's 311 program to collect this data for the entire county. Data is shared with our partners at SNAP, who are contacting those who submitted the form to create a plan to connect them with food, including home delivery options. This group has been working with the local Meals on Wheels organizations in partnership with STA to deliver meals to our seniors, and continues to work with the local school districts to make sure our kids are receiving meals, amongst many other efforts. We want to share that if you or people you know aren't sure where to go to learn more about your food bank pantry options, to use the online form that you can find at inlandcovidresponse.com or call 311 and we'll connect you if you live in the city of Spokane. If you live outside the city of Spokane, please call 509-755-2489. I've been heartened by the community's creative response to helping people. Many nimble and grassroots efforts have evolved to help fill the gaps, from Spokane Food Fighters and Rick Clark Live at 5, to people collecting food at Lewis and Clark High School, and local restaurants making sack lunches for kids in need. Together we are Inland strong, and we stay strong together. An estimated 1.6 million Washingtonians are at risk of not having enough food to eat. That's double the number of people than before the virus outbreak. That number continues to rise as hundreds of thousands of Washingtonians and Spokaneites struggle with joblessness and limited resources. As we face this unprecedented demand, donations to food banks are down by 70%. Please, if you're able to donate to the Washington Food Fund, www.wafoodfund.org, and we'll share the link. This effort will support getting food boxes out county by county through our partners like Second Harvest and Northwest Harvest. If you're unable to donate money, please consider helping by donating your time to volunteer. I shortly will turn over to Drew from Second Harvest, but I want to say a little bit about the work that they're doing. Prior to the COVID crisis, Second Harvest was providing food for the equivalent of 70,000 meals a day throughout the Inland Northwest. They're working hard along with our partners in the Food Continuity Task Force to ensure we are filling the nutritional gaps for people in poverty, the working poor, the elderly, the disabled, and people on very low fixed incomes, for our homeless people, and of course for those who are newly facing crisis with food stability. So it's my pleasure now to turn it over to Drew.
Well, good morning. Thank you, Representative Forcelli. Thank you, Dr. Lutz. I want to start by thanking all of the many agency partners that form the backbone of the Emergency Food Network in Eastern Washington. You and the volunteers that support you have been really critical through this effort. You woke up one week and you were on the front lines of a pandemic as essential workers, as essential as those that staff our grocery store. So thank you for what you're doing to make sure that the most vulnerable among us have access to food. Emergency food systems in our region are really straining to cope with the surge in demand at all levels. And we find ourselves transitioning from a state of sprint in our emergency response to one of a marathon. We're resilient and we want to be here for the long haul. We want to serve folks today and we want to make sure that they have access to food next month and the months to come as well. Our team is really looking at previous significant economically challenging times and really looking for trends that we can utilize to plan for the future. We're responding to the current surge in demand now, evaluating how this is becoming the new normal, and preparing for a wave of newly vulnerable people who will seek assistance as unemployment reaches historic highs. Second Harvest is mobilizing as much community support as we can right now through private philanthropy, the food industry, and volunteers, and that is what is enabling us to keep the response going. It's because of the support that we're able to serve a portion of the need, but we know that we must continue to search for bigger solutions. As the scope of the economic fallout of this crisis continues to unfold, it's going to be challenging for us to sustain the pace. I want to tell you a little bit about what we're doing now. We're distributing hundreds of thousands of pounds of donated food and purchased truckloads to agency partners, or they're picking up at our warehouse, and that's happening every day. We're working with our partners in the grocery and food industry to procure and rescue as much food as possible and very quickly get it into the hands of families and agencies that need it. And we're distributing disaster boxes directly to families through our mobile market. We'll be at the Spokane Valley Mall today. See 2harvest.org how to get food assistance for more information about that. And we're working with groups like the Spokane Food Fighters, connecting with people falling through the cracks. We're also partnering with Spokane Public Schools and At the Core to deliver Bite-to-Go kits to children in need, as well as emergency food boxes at select school sites. And we're partnering. We're working with the state of Washington and the Office of Governor Inslee and our statewide hunger relief NGO partners, Food Lifeline and Northwest Harvest, through the Washington Food Fund to raise funds and procure much needed shelf-stable food items for families in need. And we're also working with the National Guard. There's 30 guardsmen and women deployed to our facility in Spokane and 25 in Pasco, and they're adding a tremendous measure of productivity and safety during the crisis. They're serving alongside our staff and volunteers, helping us procure, sort, and package food into boxes and bags. They're assisting us with food transfer between our facilities. They're helping us protect public health and safety by ensuring that we can socially distance inside of our warehouse. And we're making sure that food bank operations can continue to process community donations. And as many volunteers are staying home and staying safe, the National Guard really helps us out. So with that, I'd like to turn it over to Carly Courtwright. Thank you.
Thank you, Drew and Representative Forcelli. I just want to echo some of the comments that they've made regarding the great effort of everyone in our community to support food continuity in our community. The one thing that you can really do to help, if you can, financially, is make those donations. I know people are very interested in donating food. We're concerned about the spread of the virus, and so we really ask that instead you focus on those monetary donations if you can. We are looking at other volunteer opportunities because we are Inland Strong and everyone wants to help where they can. So we really encourage you to go out to the United Way website, volunteerspokane.org, and you can sign up for volunteer options through that organization, and we'll connect you to the best fit there. Other concerns I know that we have heard through our task force, where we're focusing on all those different levels of the population, as previously explained. But one question that's really come up is help for our seniors. If you are over the age of 60, a lot of the restrictions have been dropped regarding eligibility. So we really encourage you, if you are over the age of 60 and are struggling with food, to contact Meals on Wheels, either through Mid-City Concerns or Greater Spokane County. And that way we can really ensure that we're getting you the meals that you need. Anyone can also reach out to 311 or 509-755-2489 if you're outside city limits, and we will fill out that form for you if you're not able to do so online, and that way we can try to connect you and make sure that that is happening. I think the last thing that I really wanted to address before we open up for questions was just the work that this task force is working on. We have representatives from Spokane Public Schools, ESD 101, the Meals on Wheels organizations, the Second Harvest, Northwest Harvest, Northeast Community Center. We have a great range of volunteers along with Spokane Regional Health representation to make sure that we are addressing this, and not only the short-term need, but as previously said, we expect that there will be great long-term need in our community, that this is unfortunately going to last long beyond when we are able to leave our homes and venture out, that the economic impacts are going to create food insecurity for quite a while. We want to make sure no one falls through those cracks, so we are working on it. Please reach out if you need assistance, 311 or 509-755-2489. And I think with that, we will open it up for some questions.
First two questions will be for Drew. Drew, could you touch upon the sale by date and provide some more clarification on food that individuals might find in the pantry that have some concerns about the sale by dates?
Yeah, absolutely. We work with all of our agency partners to ensure that food that is distributed from our warehouse meets those dates. If you do see a date on a can or product, that's often the sell by or best by date, and that's just the date at which the manufacturer says we stand behind the flavor, appearance, taste, texture, color of this product. It doesn't mean that it's unsafe to eat. We recommend when you're looking at food items that you consult the food keeper. I think we'll post a link to that in the comments, which really outlines the date that a product is safe to be consumed beyond the sell-by date that's on that product.
Our next question is about the precautions that are being taken at the warehouse when food is being distributed out to the pantries. Could you touch upon the precautions that are being taken to make sure everything is sterile and free of virus connection?
Yeah, Second Harvest really we hold ourselves to the highest standards for food safety. Even prior to this crisis, we were inspected annually and received the highest marks available in our industry for food safety. So sanitation of all high-touch areas, glove use, hand washing stations, we follow all those procedures. We certainly escalated that as word of the virus began to spread, and we're doing everything we can to make sure that folks who are with us are healthy, asking them to make healthy choices, and of course they're wearing gloves and masks at all times as well.
Can you speak to the job all of the incredible volunteers have been doing throughout all of this? That's for whoever would like to answer that.
Yeah, well, I'll just say, thank you to the folks who volunteer at our warehouse, who join us at mobile markets, distributing food directly to folks who need it. Also want to say thank you to all the volunteers that support the agency network. There's about 250 of those partners spread out throughout the 21 counties of Eastern Washington and the 5 of Northern Idaho that we serve, and y'all are doing amazing things out there, so thank you for that. Anybody else would like to speak to volunteers?
So this is just indicative of what we are as a community. People are coming out in records numbers to make sure that their neighbors, their friends, their family members aren't struggling, and I think it just, the hashtag Inland Strong is just at our core here in Spokane. And I think one of the interesting pieces with our food banks, particularly a lot of those volunteers were over 60 and particularly vulnerable to this virus. I think that understanding that there is some gaps there. So for people to go on to the website that Carly mentioned and sign up to volunteer would be excellent, but we're just overwhelmed by the response of this community at this time.
And we have a couple of questions for Dr. Lutz as well. One of our viewers asked if you could speak to where some of the nursing home and long-term care facility outbreaks are right now here in Eastern Washington and what's being done to deal with those.
Yes, with respect to long-term care facilities and also what we call adult family homes, we have a number of those in our community. Certainly not, thankfully, the numbers that we've seen elsewhere. We are closely monitoring those because, as you know, they are high-risk environments for people, and so we're actively monitoring those. Thankfully, as I mentioned, we have not had those types of outbreaks as have other communities at this point.
And finally, this will be our last question here this morning. Another viewer was curious as to what loosening of social distancing orders right now would look like here in Eastern Washington.
Yeah, that's the probably $1 million question, and I don't have $1 million to answer that question. So I think it's really to be determined. As I've mentioned before, and as I mentioned earlier this morning, there will be metrics that public health officials will look to determine whether or not we're seeing improvements, such as overall the number of cases, number of new cases, hospitalizations, things of that sort, that will guide us helping elected officials and Governor Inslee determine when we are safe to come back to some state of normal. Again, the metaphor that I've been using is that it's like opening a door and you're not quite sure what's behind the door. You have to open it very cautiously, but also be ready to slam it shut. I do not want to open it wide and all of a sudden find something behind the door that I don't like. So I think slow and cautious is definitely the way to approach this.
And we actually have one more question, if you could you explain your concern about child care and retirement home numbers, the numbers coming from both child care and retirement homes?
To the best of my knowledge with respect to child care, I've not seen significant issues around child care settings. I have, however, as I mentioned earlier, we are monitoring a couple of long-term care facilities and what we call alternate family homes for those individuals which we know are high risk. So again, we continue to monitor those closely. We know those are very high risk settings for those individuals. Okay, well, thank you this morning for tuning in with us. Thank you from Second Harvest and Representative Shelly to talk about food. We know that's a major concern for us. And as I have continued to learn my sign language, please stay home, stay healthy, save lives, and wash your hands. Thank you. We'll see you tomorrow.